Premier is here. Premier Heating and Air service calls are now only $69. Your first pound of Freon is free. And if you need a new replacement system, Premier Heating and Air is now offering 60 months financing at 0% on all new AC systems. Premier also offers great second chance financing. Log on to dublin.premierishere.com and let's get things cooled down today. Premier Heating and Air, a locally owned and operated company with approved credit. Offer expires 8/31/2024.
Welcome everybody. I'm glad to be here today at Middle Georgia Internal Medicine. We are brand new, and I have with me Amber Martin. Amber, I know you're busy. I've been watching you run around out there, but thank you for pausing just a minute and talking to me.
Okay.
Tell me what you do here at Middle Georgia Internal Medicine.
Well, I am a nurse practitioner here. I serve the population of 18 and older. So pretty typical day here for me is I come in, I'll see my patients. It varies. Sometimes I'm kind of like a therapist to some. But overall, just a day-to-day here, see the patients, put a smile on their face, and make sure that they leave here, with a pleasant experience.
Well, I can tell watching you run around, basically, I can tell you enjoy what you do.
I do. I absolutely love what I do. I love, my passion is taking care of patients. And that's been my passion for years, especially the geriatric population, because my parents they're getting older, and it's like the baby boomers that is what is coming up as far as the target population. And I enjoy helping those individuals with different lifestyles.
Yeah, and you're talking about me now. You're making it personal. Of course, I am a patient here, so I'll give you full disclosure. But baby boomers, there's a lot of us. Mm-hmm. And until I'm 64, until I turned 53, I was in perfect health. And it's like everything went downhill once I hit 53. And I hear a lot of people say in their 50s, your lifestyle starts catching up with you. Fried food, different things like that. And we were talking off camera. I was telling Amber, I do what my doctor tells me, and I know you suggest that to patients. Tell people exactly what you need to know when they come in about their lifestyle.
So as far as their lifestyle, I need to know their diet. What are they consuming every day? Exercise. What are you doing every day as far as, making lifestyle changes as far as your health? I also need to know, anything as far as like social history, those things that are going on in your life that could probably be a reason for, the visit for today.
Right.
All of that, family history, all of that plays a big, enormous part of me creating a diagnosis and, being able to treat the patients better.
And one thing I hear from people, they don't tell the doctor everything, like vitamins. You need to know about those things. And recreational marijuana,
Yes.
People don't want to tell a doctor that, but you need to know that and reassure people watching, anything they tell you is in privacy. You don't disclose that. Can you reassure them there?
Yes, everything that my patients tell me, it is completely private. Matter of fact, I have a lot of patients who have opened up to me more than they open up to their own family members. So I mean, that's a good thing, because once you know those factors, then it can all tie into how the treatment plan goes as well.
Yeah, well, I can see why. You and I have never met before, but I can tell already. You can tell watching on television. That's why people open up to you,
Yes,
because you are here to help. And I got to know, in what part of your life, young girl or teenage girl, did you decide, and I want to be a nurse, I want to help people?
Well, it definitely was as a young adult. Once my grandmother was ill, and I saw where you normally see, the doctors on most TV shows, but at this particular moment, I saw where the nurses had great bedside manners. They took the time and listened to the patients, the family needs, and they also, spoke about the plan that we wanted to achieve. And that's what brought me into nursing, the personal care, and just being there with the patient and ensuring them that, it may not be okay, but it's gonna be okay.
Right.
And that is exactly why I chose the route of nursing, because of being a family, being their family member away from their family.
Yeah, and it's so important. And I can see, and I hear a lot of nurses say that a loved one, a grandmother, aunt, or even their mom or dad, you don't realize how common that is for why people get into nursing, because they saw the love that came from that nurse, whether it be a hospice nurse practitioner like you. But I hear that a lot. There's no doubt about it. So somebody watching now, it's hard to get in to see a lot of doctors, but talk to that person that's watching right now why they should come to Middle Georgia Internal Medicine.
Well, here at Middle Georgia Internal Medicine, not only are we treating you for, your diagnosis or, the type of problems that you have, we're also creating a family environment here, where you can open up, where we could, laugh and, talk about and share personal experience with each other, so that we can help each other along the way to make sure to ensure that everything here is just like I said, at home, a family. We're a family.
Yeah. And you've watched some footage while Amber and I have been talking, and you can just see where they're checking in, checking out. And checking in is one thing, but when they're checking out, if they got a smile on their face and they're leaving that way, that means they've got reassurance, whatever the diagnosis is. And it may be a lifestyle change, like you said a minute ago. And before we take a break and bring the doctor in, is there any of those lifestyle changes that you can talk to baby boomers now, that they need to go ahead and make that change if possible, ahead of having any kind of problems?
Drink water.
Yeah.
A lot of my patients, the baby boomers, they're lacking water intake. Also, increase your vitamins. Increase your exercise regimen. Just 30 minutes of cardio a day. Increase your protein, not so much as carbohydrates, but increase your protein, because that'll make you feel full a little longer, and you won't have the urge to eat more or drink more as well, like sugary items. And also stay away from fried items. I know we're down here in the South, but just try to stay away from the fried foods. Cholesterol.
Yes. Yeah.
But overall, you do those things, at home, and then, we'll take care of the rest.
Yeah, you'll be ahead of the game anyway. I used to never drink water, and Michelle Whitehead, matter of fact, with this organization, I said, well, I drink sweet tea. That's water. It's mostly water. No, you got to drink water. Yeah. And as you can see off camera, I drink water all day now. I drink a lot of water, and it will help in so many areas just by drinking. The body needs water. Yes. So that's I was glad that was the first thing you said there. And you're getting personal on that fried food now. Come on now.
Hey, I'm from the South too.
We like fried chicken, fried fish, but moderation. It's okay. We eat fried foods one time a week. But you really don't miss it once you start doing those other things. You really don't miss it anymore. And it's something, as baby boomers, and on behalf of baby boomers, we do have to get ahead of that, because we grew up. My grandparents had a bucket of lard. You probably don't know what that is, under the sink, and they just throw that big clunk of lard everything they cooked, and we grew up that way. But as we get older, those things start telling on us too. So with that high cholesterol, so good tips, and I appreciate you joining us today. We're going to take a break, and we're going to come back and introduce you to the doctor at Middle Georgia Internal Medicine.
Summer's here and the temperature's rising, so make a big splash with friends and family now with a pool from Georgia Pools. Or relax in a luxurious hot tub or sauna. No down payments and easy financing. Don't wait a year for your pool. Georgia Pools has the manpower to get the job done. Georgia Pools has a large selection of pool chemicals and accessories. We also have Traeger pellet grills along with the pellets and accessories that you need to get you grilling today. Come see our selection of Yeti coolers, tumblers, cups, and more. Don't forget our collection of Big Green Egg grills and accessories. Call Georgia Pools today at 478-275-3607 or come by and see us at 1201 Hillcrest Parkway in Dublin.
Quality products and installations since 1985. That's 4 Seasons.
Welcome back, everybody. I have with me now the doctor here at Middle Georgia Internal Medicine. And doctor, y'all are fairly new. And before we get started, tell our viewers a little bit about yourself.
Hello, everybody. My name is Dr. Raghu Lolabatu. So I'm an internist, and I've been in Dublin almost 23 years now. And I've been practicing myself in Middle Georgia Internal Medicine. We've been serving our population for last 20 plus years, and mainly our practice. So we primary care, serving a lot of geriatric patients and a lot of young people too. And we primarily take care of more internal medicine. You know that our main problems in our country is diabetes and blood pressure.
Yeah.
These are the killers. These are the silent killers. And a lot of us, we don't know, we don't realize this is a problem, and because they don't hurt you till you get to the doctor. So that's one of the main problems we deal with that, which these two, and also blood cholesterol problems altogether gives us so many problems, so many consequences like strokes, heart attacks, and so we primarily stress on. I myself really stress on prevention. Yeah. That's the main thing we need to work on.
Yeah, preventive medicine. There's no doubt about it. I mean, that's you need to do it. You need to get ahead of the situation. I was doing a show last week with a doctor, internal medicine doctor at the hospital, and he said, it just blew my mind that he said in the South, there's more amputees than anywhere in the United States.
Absolutely.
And a lot of it's got to do with diabetes, just like you just said, drinking all these soft drinks. And a soft drink is pretty well all sugar and a little flavor.
Yeah, absolutely.
But
I was reading some article, James, I'm telling you. So on an average, American, they eat about 40 teaspoons of sugar. Believe it or not. I was just watching on some show, every 2 ounces of the Coca-Cola or any of those products have two spoons of sugar. So imagine how much sugar we're drinking every day.
Yeah, and if you're drinking 3 or 4, that's more sugar intake than probably need in a month.
Absolutely.
Then eat some cereal in the morning. It's just coated with sugar.
Keeps on going on, every meal. So every meal the same thing, and add on a lot of add-on stuff, and there's so many things. So it's the dietary habits we need to change it. That's one of the main things. Really, really, really problematic for us, for all of us.
Yeah,
Yes, sir.
Absolutely. You're talking about geriatric. Of course, I'm a baby boomer, and there's a
Yes.
bunch of us. You talked about preventive medicine.
Yes.
Talk just a little bit more about that. People, you know, I'm in my mid 60s. A lot of my friends just have never went to the doctor. They're more, nothing's wrong, then all of a sudden, you didn't get colonoscopies like you should, or you didn't get your cardiologist like you should. What would you say to encourage those people?
I'll tell you one thing. We'll see that. So a lot of patients, they come like, oh, when was the last time you went to the doctor? Well, maybe like 10 years ago. Oh, I didn't have any problem. You don't go to the doctor because you have a problem. You go to the doctor not to get into problem.
Amen.
That's the main thing. We all have to realize that. So, yes, as I said, like prevention is one of the main things we have to. I myself very particular about that prevention, and so once you cross 50, I mean sometimes even 40s too, we start having screenings, and you have to check your blood pressure, make sure diabetes, and the prostate problems as we grow, and your colonoscopy, make sure the cancer screenings, and so many things, so forth.
Yeah.
So especially when you said like the baby boomers in 60s now, they all have to have a lot of screenings goes on.
That's right.
So that's the federal government and the state governments, they work a lot on the preventions, and the Medicare, CMS has so many guidelines. We follow that for the prevention of the cancers, prevention of glaucoma, prevention of the blood pressures and diabetes and all the stuff. I think I would definitely strongly suggest each and every one, please go to your doctor, get screened, get things done. If you find you're good, at least go once a year. That's fine, good. But if you find something like we see that so many.
Yeah.
So they come here like 45, 50, 52. And unbelievable, we find so many problems all of a sudden. Oh, really? Do I have that many problems?
Yeah.
Yes, you do. You've been living with that.
Yeah.
So
keep waiting and waiting. So
yes, sir.
You know, and I hear even doctors say this to me. I don't like going to the doctor. I'm a doctor and don't like going to the doctor. But that's something we have to get on people. Some of you are watching now and say, I just don't like going to the doctor. Well, you got to. You got to. You may not even like going to the doctor, but you need to see your cardiologist. You need these things, these polyps checked out that you get in a colonoscopy. But so, do you like going to the doctor?
Yes, I do. Yes, I do. I would go to myself every day.
Yeah. You better like the doctor.
I like my doctor.
He's a good doctor, isn't he?
So.
What's the most things you see here at Middle Georgia Internal Medicine?
So this is what we call as a medical the field. We call the stroke belt. Mm-hmm. This is called the dialysis belt. So we're talking about this the Georgia, Middle Georgia, and go to Alabama, that Mississippi, so on and so forth. So a lot of things is the dietary habits and not taking care of themselves, and lack of education, and there's so many things so forth, which is really getting into all these problems too. So yes, we do see the unbelievably the prevalence of diabetes here, unbelievably prevalence of uncontrolled blood pressures, and we got 30s and 40s, we see that patients on dialysis. So that's so much burden for yourself, your family, and for the whole country. Yeah. Yes. So those things can be preventable. They all can be preventable if you go to the doctors. And so we see some patients. If I go tell them, "Oh, I don't have all those things," no, I'm not going to come back to you. No, please listen to a doctor.
Yes.
They're telling you for your benefit. Seriously, that's what I would suggest.
Yeah, I told you off the air that, I go to the doctor to do what the doctor says, but so many people, and they lie to their doctors. So many people I know, they say, well, I don't want to tell him this, I don't want to tell him that. But you need the whole picture, don't you?
Yes. Mm-hmm.
And a doctor like you is a non-judgmental person. You're trying to treat the patient, the holistic patient. So it's so important that we tell the doctor the truth, no matter what it is. Some people have habits that they're not proud of, but if you don't tell your doctor, you may prescribe some medicine that's counterproductive
Yes.
to recreational marijuana or certain vitamins and things like that.
Absolutely. So as we have ethics and we have obligation towards ethics, and so whatever we have the confidentiality between the patient and the physician, so that stays with them. So unless you help us, we can't help you. That's always there. So be open to your doctor, tell everything, and let them understand you. Because I always tell, this is very, very important relationship, the patient and physician.
Yeah.
If we can't have that relationship, it's very hard to get treated, and hard for a physician to treat you also.
Yeah.
Yes.
Trustworthy.
Trust. You trust your doctor.
Yeah.
Trust your doctor.
Absolutely.
Of course, I understand that not every patient gets same feeling towards every doctor, but if you don't, but find a doctor
Yeah.
you can trust, but make sure that you present yourself.
Yeah.
That's very
Well,
important.
I think you can already tell you can trust this doctor right here. So, I mean, you're talking just as plain as anybody watching can understand.
Yes, sir.
And before we go, last question I want to ask you is, you've touched on it, but talk to that patient, well, they're not even a patient, like you said a while ago. A lot of people just don't go to the doctor.
Yes.
But the older we get, we have to go. I'm one of those that I get those preventive things, all them things you've mentioned. I used to didn't do it, but when you turn 64 like I am, I've been doing it 15, 20 years now. I'd rather find out ahead of time, hey, you've got these polyps, this is going on. You need a heart stent, because if you wait and then all of a sudden, people tell me, well, I schedule everything. I got in my phone this and that, but we don't have in our phone 3 o'clock this afternoon have a heart attack and die. You don't know those things.
That's right. Yeah.
But your body will communicate those things, won't they? Talk to that person about the one that does not go to the doctor.
So as I said before, the going to physician is very, very important. You rather start those things very early, and for this, a lot of our screening starts from age of 40, 45. So depends upon your family history. Sometimes even earlier too. So from 50, definitely you need to have for male prostate cancer screenings and colon cancer screenings, and for female mammograms, for the breast cancer screening. Believe it or not, we find so many here. But I'm so happy that we could find last year. I'm telling you, so many cancers we found stage 1 even below before that. So they're so happy. I'm telling you, they're so happy. Without minimal invasive treatment, they're cured.
Yeah.
So this is very important to know, that catch early, treat early.
Yeah.
That's very important. So only thing that happens if you go to the doctor,
Yeah.
right?
Yeah.
So your treatment won't come to you. You have to go to the treatment.
Good way to put it.
Good word.
It is a good way to put it.
Yes,
but
sir.
we have to get over that fear of, you hear it all your life, that white coat syndrome.
Yeah.
But you need to go to that white coat. You need to go see that doctor. So, and when you find out early, just like you said, a lot of things can be handled when you catch it at that stage 1 instead of stage 5.
That's true. I know there's the fear in some patients, not everybody. That's what a doctor, they get more apprehensive. But no, so probably yes, yeah. As I said before, go find a doctor where you're comfortable with.
Yes.
But go to him.
Yeah.
Go to somebody. Find somebody.
Yeah.
If not one, somebody else.
Yeah.
So that's very important for you. But doesn't matter who the doctor you go find somebody. If you're not comfortable with one, find another one.
That's
but you
right.
need to go them.
Yeah.
So, but yes, it's that's there. We see that a lot of times. They come here, the blood pressure goes high. Say, calm down, you'll be fine. So they just, I think it's more apprehension.
Yeah.
But don't be that, because it's very, very important for you to go to the doctor and go find what things happening. Most important thing is this is what another important issue we come across all the time, compliance. So your doctor gives a prescription, or you ask you to go do some test or something. Please do go,
Yep.
because he has a reason to tell you do that.
Yep.
You know, it's not that for his benefit, but it's for your benefit.
Amen.
Yes. So the doctors always they always think about your benefit. I can tell that on my put my hand on my heart. We always tell them to do things for
Absolutely.
your
And,
benefit.
before the break, you met the nurse practitioner here, you see the doctor here, and we invite you to come in to see Middle Georgia Internal Medicine. We're at 106 Corporate Square. We're right in the shadow of Liberty Baptist Church over here, so we're easy to find. When you come past Liberty Church on Hillcrest, turn in and you'll see the sign on the door, Middle Georgia Internal Medicine. Doctor, thank you so much.
So thank you very much, and thank you everybody watching it.